would love to talk about that because honestly, I would say that is probably one of the biggest drawback to young doctors going into, practice of medicine, having to deal with the complexity of the current healthcare system. I'm a geriatrician, so a lot of my patients are on Medicare, which I'm very lucky because Medicare as a system, it's really easy to deal with. The overhead is extremely small. I know exactly what's covered, what's not covered, even though it's not a perfect system. And I'm hoping with CalCare and eventually with Medicare for All, we will definitely improve on the current existing Medicare structure. But regardless, it's still the amount of time and energy that needs to go into getting authorization. There is no comparison. Like I said earlier, unfortunately, yeah. Can you hear me?
I wanted you to add on it one more thing because I mentioned my father's on Medicare. He has spent a lot of money on dental and vision out of pocket. So tell me about that as a geriatric physician. Tell me about what you see with your patients that have dental issues, vision issues, long-term care. How do you see that issue being? What is it like, and how can we improve upon that?
Absolutely. I believe if we are able through CalCare to cover patients' dental, vision, hearing, long-term care. I mean, these are essential services that are unfortunately currently not covered, even under Medicare. And a lot of healthcare insurance companies don't really cover these things. These are selective services that, as an employer, when you contract with them, you have to include or exclude some of these services. Under a system like CalCare, all this will be included. The benefit of including all these services, under a big umbrella, you have the negotiating power. So you can actually bring prices down. You provide services that are so crucial and essential for patients' well-being, ability to stay home independently, providing. So currently with something like Medicare, you actually can get home health services. So people can stay in their home and get some support at home. It's not perfect. It's not ideal. We want to improve on that. With CalCare, it will definitely improve on that because you will be providing long-term care that doesn't exist right now, for example.
And also a lot of, my father included, a lot of seniors pay for Medicare Advantage and these premium programs. That's those kinds of things they're paying for would also be included, so they wouldn't have to go out of pocket additionally.
Absolutely. Well, unfortunately, right now there is a huge move to try and privatize Medicare and contract it to these advantage care plans, which honestly I don't encourage people to sign up with because I believe they are selectively taking healthier patients. And when someone gets more complex in terms of the level of care, they sort of drop them out of their system and back into straight Medicare, I call it. Of the secondary insurance, people don't have to buy a secondary insurance to supplement their existing Medicare. It will all be covered under one single insurance. They don't have to pay out of pocket for any of these services.